think the most striking thing that appeared both in the hospital setting and outside it emerged to be the keen attention to keeping time and discipline that came like at an individual level. It demonstrates a very professional and a very respectful sort of approach towards especially patient management, because a time that's given to someone, you're there for them and you're attending to them, and these are important aspects that come into play when you're trying to look at the holistic aspect of patient care which needs to be approached. In a system where you have such a socially inclusive element where the cost element does not really come into play in patient care and healthcare provision, this was really well brought out in the Swedish system, because as a healthcare worker, you're then able to provide the most optimum type of solutions and care plans that you want for your patient without really considering the aspect of how much of a cost burden you're putting on them, which is a bit different in our case because we really have to factor this aspect into it, and at times you'll find yourself having to use approaches, remedies which are not necessarily optimum there are better options, but you're just constrained by the amount of cost that you're working with in this case.
What I learned most was about infection prevention and patient safety in the wards, and the role that we as nurses have to play to ensuring that patients come out of the health facilities free of infections. And we went a long way in doing skills like gloving, ensuring appropriate waste and disposal and segregation of waste, ensuring that the patients have individualized care in the various rooms so that they don't share anything with other patients to prevent infections, and also issues of patient safety emotionally. We had counselors coming to visit the patients, how you provide privacy for the patient before doing a procedure to them, and maintaining the secrecy of the patient's details.
First of all, I was placed at chronic pain and rehabilitation, which specializes in management of patients with chronic pain. And when you come back here, all of us, we are training towards giving patient or trying to make patients comfortable. And I think there we are using the multimodal aspect of patient management, and this incorporates that everybody in the health care professional need to be brought in board when managing patient. If I try to compare the two, that is back there in pain and rehabilitation and here, I think there was much improvement which I can borrow from that into my future career, whereby as we deal with patients, we need to put the patient into focus, and after doing that we need to bring everybody on board who is concerned with the patient. And this in fact even also motivated and inspired me to work more towards a multidisciplinary approach in patient care, and I'm going to that direction.